In the 80s when I went to school, that's what you were supposed to use it for. Supragingival growth calculus. Well, I never had a patient that qualified. I never even used what we, loosely call the cavitron, or that's magnetostrictive technology, even in school. And I think now, well, how did I go to work the first day and just pick up an ultrasonic when I never had that experience? So that's why I talk about the fact that I got that award, because I made such a transition. And many of you are probably like me, graduated from hygiene school in '88. So I'm a product of my education and then my journey from there. So I always think that that's a great place to start when I talk about where I came from with ultrasonics, because it's funny when I speak and to come to the very end of it now, when I do clinical hygiene, I'm mostly using my piezo and very little hand scaling. So people think I just got out of hygiene school and I was like that all my life. Like I was born like that kind of thing. No, and I think when I get that barrier eliminated, people in the course say, oh, wait a minute, if she was like that before, then maybe I can transition. So that was really why I made this course, to help people. Tongue disinfection by sweeping the tongue. Anyone ever hear this? Yes, raise your hand. Yes? Okay, is anyone doing it? Okay, a couple of you are. Okay. I want to tell you, I have here a typodont, and I'm just going to go, because people are so interested in this. It's really important to do this for every patient, not just your perio patients, but your regular patients as well. So anyway, when I started doing it this way with the ultrasonics, I have the lavage and the cavitation, the microstream, everything we learned about working for me, and I would start at the tip of the tongue. And by the way, I did not invent this. People think I have. I went to a course and learned this, and I thought the speaker was nuts, because all I could think of was, see the point? They had no slide. That's why I made sure I have a slide, because I'm thinking ultrasonics on the tongue? I couldn't even follow, because I didn't know this stuff. So I make sure when I teach it, I show you, what it should look like. In other words, the side. And you say, Colleen, do I have to have a piezo to do this? No. But the side, don't get one of your curvy mesial distal inserts. If you have a piezo like I do, don't get the one with the blade on it, okay? Just one that's universal, as you can see there. Start at the tip of the tongue, and you just go backwards. And yes, it's on, and you've got the cavitation, the microstreaming, and the lavage, and so forth. Just keep working back, back, back. When you get back here, now I wear loops, but when you get back that far, sometimes you can see those circumvallate papilla, the ones that are shaped like mushrooms. You can see a round kind of circle of plaque around them. I've seen this so often, again, and I have a light on my loops too. But you can actually clean that off, because that's where the volatile sulfur compounds are. It causes bad breath. Okay, so I say all that to the patient. You don't explain to the patient what you're doing. You don't have time for that. This is my protocol. I go around the lower arch, okay, and I change the position of my chair when I work on the upper arch, right? And I usually have them take a break in between. All right, ask them, would you like to rinse now? Yes or no, depending. Well, when I start back, before I change the position of the chair, I'll say, now you might notice I'm on your tongue right now. Don't think I've gotten confused. I am really cleaning your tongue, because now we know the tongue is a reservoir of bacteria, and all those germs are just going to translocate to all those areas that I cleaned. So in order to do a really good job for you, I want to get all those germs off. And after I'm done, and I go all the way back, the patients are like, wow. Like, I was like, in the beginning I said, did it hurt? Like, how did it feel? And so just, take it from me. It does not hurt them, and they do not gag. The gag reflex is where? On the top. The only thing when I started doing this, I did have a magnetostrictive unit, and I was afraid that the water would splash on the top once I got back really far. I've done this on gaggers. Gaggers, I would say I don't get back to the circumvallate papilla on a gagger, but I get everything else done, and you would not believe how far people will tolerate this. The thing is that, did you ever have patients that'll say, they brush and they floss and do anything, and they'll say, I still have bad breath. And the only thing I knew was stomach problems, which it could be, but once you rule that out, where else could you go? Well, there are some patients that are so grateful, because they're saying, well, maybe this is the answer. And then I say, well, have you been, brushing your tongue or scraping your tongue? I don't know. But when you do this professional tongue disinfection for them, it kind of invigorates them to do that at home. Besides, it's a value added. That's the thing I hear the most is, which tip can I put on and do the whole entire mouth? And with healthy patients, you can do that. And there's plenty of universal tips. And you know how you can tell what a universal tip looks like? It's just universal. It's just straight. And there's plenty of them over there. So that's an example right there. There's an example right there. I mean, literally, if you think of this like a scaler, you know, when we were in school, we were taught a bunch of scalars. How many of you, when you went out to work, opened the drawer and saw scalars you never saw before in your life? All of us have encountered that. But you look at it because you know tooth anatomy now, and you know how instruments are constructed, and you see a blade or a cutting edge or a toe, and you get it. Has anyone ever gotten their, let's say, 13, 14 curette and tried to scale the distal of, let's say, 14? And just the way the teeth are positioned, you're not even able to do a working stroke. You know what I mean? And you see, this is what I say to myself, okay, I can't do anything. I'm not doing anything for this patient. I can't even get a working stroke in there. I tried all these other instruments. I can't get in there. The great thing about having like the piezo, where if the tip is that thin, and you can see here where it's going to wrap around, you've got all the technology working for you. You've got the lavage and the cavitation and the microstreaming. So if it is tight in there, at least you've got all the effects of the ultrasonic working for you to help you in that area.